My name is Colleen Nelson, and I am making my videos for cardio and peripheral vascular assessment for St. Kate's University. Hi Ben, I'm Colleen. I'm going to be your nurse practitioner today. I'm going to be performing your assessments on your cardiovascular system and your peripheral vascular system. I will be doing some inspecting, I'll do some palpating, and then I'm going to also listen with my stethoscope. I'll let you know what I'm doing and kind of walk you through all the steps as I'm going. But let me know if you have any questions or if anything makes you feel uncomfortable. Do I have your consent to start?
Yes.
All right, perfect. Perform hand sanitizer, and I'm going to put some gloves on. So the first thing that I would do is I would obtain a blood pressure, both supine as well as sitting up, just to check for volemic state. And then for this video, I am going to sit down just to be on the same level with him so that you can see me and him in the video while he is sitting and standing up. So the first thing I'm going to do is I'm going to check your carotid arteries. I'm going to check one at a time here, just palpating them. Making sure that they're symmetrical here. Next, I am going to auscultate for any bruise. Use the diaphragm and the bell of my stethoscope. Next, I'm going to inspect and then palpate the chest wall. Inspecting, I'm looking for any precordial pulsations, any heaves, any thrills, and then I'm going to use the palm of my hand to feel for any heaves or thrills. And then I'm going to palpate at the apical pulse, or the PMI down here. And then I'm also going to do the same when I have him laid down in a little bit. Okay. Next, I'm going to auscultate the 5 spots. And I'll also be using both the diaphragm and bell of my stethoscope. So I have the aortic, pulmonic, Erb's point, tricuspid, a PMI, and mitral. I'm going to do the same thing. The aortic, pulmonic, Erb's point, tricuspid. And as I'm listening to the PMI, I'm listening for S1, S2, any murmurs, any gallops, and mitral. Okay, and then I'm going to have you lay down. You can put your head over on this side. Okay, and then I'm going to palpate as well now that he's at a 35-degree angle. And then I am going to listen, see both sides of my stethoscope again. Okay, and then next I am going to measure for jugular vein distension here. Just gonna line this up here, and then I'm looking at the pulsation, and then anything less than 2 is normal. And So that completes our cardio assessment. I'm going to have you sit up again and we're going to move on to our peripheral vascular assessment. So first thing that I'm going to be doing is I'm just doing an inspection and then also just feeling as well, looking at the color of his skin, looking at hair distribution, and then also just feeling the temperature of his skin. His skin has a nice red tint to it. It is not pale. Skin temperature is warm. He's not cool and clammy. And then I'm just going to back the camera up a little bit so you can see our extremities here a little bit better. I'm going to check for edema here. Lift his foot up so you can see it. Okay, so I'm just pressing down and it immediately comes back. There's no indentations. I'm going to do the same over here. Okay, perfect. And then I'm just going to palpate your pulses here, doing your brachial. Do the same on the other side here. And then also just palpating the epitrochlear nodes. And then I'm going to do radial. And then down at the bottom, just doing tibial here. And then I will also do this dorsal on the inside here. For your pedal pulses. And then I'm going to do underneath your knee and the cocktail. This is a deep one. Okay, that concludes our assessment. Thank you so much.